So there's today I'm with Karen Neal. Karen is a community pharmacist and also a trustee of the Institute of Health Prevention and Education, and loads more. I'm Sue Cooper, and this is part of a series for Feast for the Soul called Co-Creating Compassionate Communities, and particularly in the most beautiful way, compassionate disruptors. We're looking at what actually goes on in our communities, within our chosen community, and how if we beam a spotlight on what's going on and really what we could do to improve the services to our community, then once we raise awareness, maybe that's something that can take hold and grow. So Karen, today we're talking about pharmacies and pharmacists, and I wonder if I could ask you to introduce yourself for those who haven't met you before, and what the passion is that is raising its awareness within you and your work. So I'm passing over to you. Thank you.
Thank you, Sue. It's always a pleasure to talk to you, particularly about health, meditation, whatever, but with your nursing background and my pharmacy background. So I'm not currently working as a community pharmacist. I trained in hospital pharmacy, then went into research in quite scientific research in pharmacology and how drugs work in the body was my fascination for a while. And then on to public health research and working in community pharmacy around that time as well to support the research. So pharmacy is very much in my heart, and a big part of my role at the moment as a trustee with the Institute for Health Promotion and Education is to advocate for pharmacy and many other things. And all things health promotion. Excuse me. Pharmacists, like many other frontline workers in health, are having a really challenging time at the moment, and are underutilised in terms of health promotion and prevention and supporting self-care. So very much working in advocacy through the IHPE as trustee is a big part of my role. And I also work as a health coach and teach mindfulness.
And Karen, would you share the reason why you moved from pharmacy, even though you're still within education, to mindfulness? Yeah. What was the catalyst for that?
Yeah, so as a pharmacist, I specialised in health promotion and mental health. Working in community pharmacy, I became more aware of the impact of stress on disease and how it felt like a lot of the time we were, giving the medicines we were giving, it was like applying sticking plasters, and that stress was either causing or exacerbating a lot of the problems we were seeing in community pharmacy. And I know I've shared with you before my shock of as a new pharmacist discovering we had something we referred to as the fast mover shelf, where the commonly used medicines were stored to basically save our legs because they were going out so often. So painkillers, antidepressants, medication for blood pressure were the three that really stick in my mind. And I think this influenced my interest in mental health, that, asking why are so many people struggling with mental health, and it's only got worse since then. I qualified in 1994, and it continues to get worse. And I discovered the work of Jon Kabat-Zinn and his book Full Catastrophe Living. One of the most difficult sides for medicine really is managing long-term conditions, particularly as we get older, because a lot of drugs are metabolized and excreted through the liver and the kidney. They don't work so well as we age, and we become more vulnerable to side effects, and managing long-term conditions like pain, diabetes, depression becomes more challenging. And Jon's work developing mindfulness-based stress reduction not only looking at how we can reduce stress, which was the, looking at how that could then benefit our health, but also the clinics he ran contained a lot of people with chronic illness that he'd realised were coming out of the healthcare system, not cured actually, but living with long-term conditions.
Yes, I remember seeing him talk about how he spoke because he was working at Harvard, and he was speaking to a whole group of other doctors, particularly dermatologists, who were saying that the treatment, the ultraviolet treatment, where people stand in an ultraviolet booth, was not working as well as it had been previously. Over the years, people have become more resistant to it. And he thought to himself, just a moment, I think maybe if we do a trial of mindfulness and people meditate whilst they're actually within the booth, and let's do a really good trial on this. So yes, they set it up. And then when they came to read the data, there was a 40% increase of people with eczema with a healing for those who were meditating during the treatment. So they thought, this can't possibly be right, that we must repeat it. And again, the same thing happened. And as he says, you can do something with your mind and it affects the skin at cellular level. And because he's a doctor and he's a researcher, as are you, and the research that you have shared with me as we prepared for this, which I will put into the recording on YouTube, is it's evident, isn't it?
Mm-hmm.
So Karen,
it's a very exciting area. I remember that. I think there are studies looking at eczema and also psoriasis, and it was fairly severe psoriasis, or certainly moderate. And it's just incredible, like you say, that meditation can affect our cell turnover, which then they started to talk about how it could help cancer. But for another day, I guess.
So would you share a little bit more about this community disruptors in the nicest possible way about the training of a pharmacist is probably being underutilized and underfunded. Would you just share a little more about your thoughts and the research around that?
Yeah, well, pharmacists are really experts in the safe and effective use of medicines. And I mean, just spending more time with our patients can make such a difference. I was so fortunate in community pharmacy that a couple of the pharmacies I worked in were fairly quiet, and I did have that time. And we have an extensive training. It's now a 4-year course, certainly in the UK. So it's undergraduates come out as masters of pharmacy. It's gone to master's level, and then there's a pre-registration training year, which was the year I trained in hospital, and by coincidence a hospital that you two had worked in as a nurse, which was amazing. And yeah, so we don't have the funding to consult with patients as much as we might. So there are some additional services that have been growing, like doing medication use reviews, which the evidence has shown is very helpful. I'm aware of a pilot that's being done to look at the impact of paying pharmacists to have consultation time with patients, and how that helped to free up GP, general practitioner time, which is also a premium at the moment. And I think that, we could make so much more use of the training, the knowledge of medicines, and build these health promotion skills even more. So, things like the vaccination program, pharmacists have been key in helping to deliver that. It's been a great success. And I think just building on these things, smoking cessation, blood pressure monitoring. And I think it would be really good to see more work going into looking at how pharmacists can support weight management and addiction difficulties and alcohol misuse. There's so much scope, but it needs to be funded.
Yes, and back to the health promotion and the outreach services. Well, firstly, certainly in the UK, some of these pharmacists have beautiful places, beautiful spaces in which they offer consultations, don't they? And then moving out into school for health promotion education, that the training supports that, doesn't it? But it's again,
yeah, I mean, it can continue through, postgraduate professional development as new services emerge, but health promotion has always been integral to pharmacy training and pharmacy practice as long as I've been involved in pharmacy.
You know, I'm reminded of a story. A friend of mine who's a pharmacist said, because a while ago, before we all went digitalized, I had a couple of CDs with meditations on. And a friend of mine said, similar to you, she said, I'm giving out so many drugs that I feel they don't necessarily need, they've got them, but wouldn't it be wonderful if we could give them something, a practical tool? So she bought about 25 of my CDs, and then everybody who came in, well, she'd engaged in conversation with them as to, you know, the reason why they're requiring this, and of course fulfilling the prescription. She gifted, and she says, let me talk to you a little bit about the power of meditation, and maybe you try this and then come back. And people obviously continued on the medication, and rightly so, but there was an opportunity of looking at a wider framework of holistic practices that enable people to start to take control again of, you know, if it resonated with them. So it was, you know, that to have that choice. Karen, when we put out the information about this, we put a link in there about the Ottawa Charter. And I wondered if you'd be kind enough just to mention a little bit about it, because it's a very significant document, isn't it?
Yes, thank you for mentioning that. So the Ottawa Charter was signed in 1986 following a meeting of the World Health Organization, and it remains the seminal document for health promotion and how we can deliver health promotion. And it's as relevant today as it was then, and there's still so much more work we can do. So it defines health and health promotion. It defines the role of health promoters, and there were 5 key areas for health promotion. And I think, you know, thinking about pharmacy, one of the key areas that we talk about a lot at the Institute for Health Promotion and Education is health promoting settings. And in a piece that I wrote with one of my colleagues, Dr. Michael Watson, for the Pharmaceutical Journal, you know, we suggest that the gold standard would be health promoting pharmacies, and then from there rippling out to supporting health promoting schools, health promoting workplaces, you know, health promoting anywhere.
Yes. And I just happen to have these 5 points in front of me. So
okay, yes, I think I've got them somewhere here.
So the 5 action for health promotion, as identified by the Ottawa Charter, is building healthy public policy, which you're involved in. We'll get onto the Institute of Health and Health Promotion and Education. So building healthy public policy, creating supportive environment, strengthening community action, developing personal skills, and reorientating healthcare services towards prevention of illness and promotion of health. And I'm very conscious of the fact that within the World Health Organization description of health, there's nothing mentioned about spirituality, about spiritual or emotional well-being. So, you know, that's something that, you know, is worth a discussion at some stage.
Absolutely.
But we've got a representative here of the People's Health Alliance, which we'll come to afterwards. But the People Health Alliance are doing the most incredible work of actually gaining momentum of a grassroots organisation within community, and people are self-organising healthcare, health promotion. And at that same time, we have to look at the healthy public policy. The two things it's like 2 wings of a bird, isn't it? They must go hand in hand. Eventually, as we gather in community, public policy will look at, oh my goodness, you know, we've got this incredible resource now. All these people are gathering with this intention of, we want to stay consciously well, and what skills do we need? So with that in mind, are there any other thoughts that are coming through to you when we now start to talk about the IHPE, the Institute of Health Promotion and Education, as a body for research?
Yeah, I mean, thoughts coming there. We're thinking about we've just had our 60-year anniversary, and there's been special events that are ongoing actually to celebrate that. And we held a webinar and brought together experts from across the UK to talk about health. The title was "How Do We Talk About Health?" if I remember rightly, and that is recorded and available. And some of the key points, so we've got a summary of that discussion and the key points that were shared. And communities and supporting communities comes out. Inequalities is a massive challenge, and this, as you were talking, thinking about health being across all policy areas. And actually, we've got an example locally that just came to mind as you were speaking of in housing. So we've got a new housing development nearby, and it was designed, and planning was working in collaboration with the Prince's Trust. And so it took into account community space and how it was developed, and green spaces around it. A very, very forward-thinking development. So that's an example of bringing in health across policy that you might not necessarily think of housing as relevant to health, but of course all policy areas relating to human beings can relate to health, from policing to everything. So that came to mind. I mean, as an organisation, we're very much advocating, linking to other organisations working in health promotion, collaborating, influencing policy, and inequalities. That the word inequalities keeps coming back as I'm speaking, as the biggest challenge, because of course, if we want to support people's health, then the basics need to be in place in terms of food, warmth, shelter, and deprived areas. They need to have access to the health services, and that's a concern in the UK of GP access, and increasingly because of the resourcing of community pharmacy, a lot of them are struggling, and particularly in deprived areas where you could argue that they're needed most. And there's so much access for people with community pharmacies in their neighbourhoods, and that the last thing we want to see is more of them closing and reducing access to healthcare support even more in these deprived areas particularly.
Yes. Yeah. One of our conversations was about agency, and I've posted in the chat, and I'll post on this recording, about agency and about people gathering together and having a voice. And then we went on to talk about advocacy. And there's a subtlety there, isn't there, between agency and advocacy? Would you like to just expand a little on that?
Yeah, I think it's also helpful to mention the work of the mindfulness initiative in the UK, that some people might be aware of or not. And they produced, well, they're a think tank for the all-party parliamentary group in the UK Parliament for mindfulness, and produce a lot of evidence-based documentation. So their websites and their publications is worth sharing as a link. And one of the documents that they produced was about agency and how we increase our agency. So that is intentional action, and so we can choose how we act. And I was thinking about this a lot actually, listening to practicing with Sarah's lovely guidance a few days ago, and how she talks about the power of attention and the importance of that, and how we can choose to direct our attention, and that it can be trained. And in this environment that we're living in, where there's so much competing for our attention. It's being hijacked all the time. And so we're not making so many choices that we have control over, you know, from what we're going to eat, what we're going to spend our evening watching or listening to. But amazing document about agency was produced by the Mindfulness Initiative, and then an invitation to submit essays in response to that document, which was then published as well. A series of, I think, about 12 essays responding to that document. And as you know, I contributed one about agency and health, which is my passion.
So then moving on to, thank you, Karen, and I've posted that, advocacy.
Yes.
The subtlety between agency and advocacy.
Yeah, advocacy feels like giving a voice, perhaps. Agency very much about choice. But advocacy feels like giving a voice. You know, thinking about my pharmacy colleagues, and you know that I'm not helping them at the coalface at the moment, but what else can I do? You know, given my experience, and you know, we talk about what small part can I play as an individual, that I can speak up for the profession, that I can collaborate with my friends and colleagues at the IHPE who have so much experience in health promotion and public health, because we come from such a diverse background of academics in public health to dentistry to allied health professionals such as osteopathy. And then we can collaborate, you know, talking about community and compassionate community again, say, you know, so then we can produce documents to support, in this example, community pharmacists. So we produced a position statement on safe use of medicines with suggestions as to how pharmacists can develop their role even further. So that very much feels like advocacy. Yes. I'm writing to the Pharmaceutical Journal, you know, to share, you know, the evidence base that we have access to between us.
Yes, it's there's a subtlety, but there's also a power. I often think those people who have agency have their voices can be heard when they gather together, but those people who don't have such a quiet voice that, you know, they're not able to actually develop agency. So to have the professions be the voice for them and encourage that is an important step forward. Karen, would you tell the story that you told me about the lady in the pharmacy with the twins? Because a story tells something that is so deep and it really resonated. So would you share?
I wondered which story you were going to choose. There were a couple of possibles, but yeah, the twins, they were born prematurely, so had quite high medical needs. And so this, you know, new mum sent home with premature twins, not just one premature baby, but two. And I was working in community pharmacy at the time. And it's one illustration of community that is within pharmacy. That it was, you know, years later that she said how much she valued the support that we gave her, and she doesn't know what she would have done without it. And it was a lot more than us, you know, dispensing the medicines and helping her with treatments, you know, because the name, as I said to you recently, you know, I only really fully appreciated that community pharmacy is called community pharmacy. And, you know, where pharmacists are right at the heart of so many communities. And it was a new housing development we were near, so there were a lot of new parents. So she would meet other parents in the pharmacy while she was waiting for a prescription. She'd have a chat to the counter staff. You know, she'd share what kind of day she had, you know, and so there was a broader support than just providing the medicine within that community setting. And, you know, listening to Susie earlier and her passions, I just really resonated with that and my passion to protect this, and to build on what community pharmacy can offer, and particularly in the deprived areas. you know, when and we have expertise and understanding of our area because we're on the ground, and you know what are that area's needs.
And did you meet this lady again after you'd offered the support to her?
That was a few years later. I saw her one more time, when she said, you know, how much it meant to her and what a difference it had made. But I've not seen her again since then. But I hadn't appreciated at the time. We just did what we did. You know, and it could be anyone. I mean, one patient that really stays in my heart was a chat with mental health difficulties, and one of the problems can be it was bipolar disorder, and he liked the highs, and the medication made him tremble, and he really didn't want to take the medication, but he needed to because of the impact of his illness, you know. And I was fortunate to have time to chat to him, and say, you know, look, we can tweak the doses. And I work very closely with the GP, you know, so these networks and connections are really helpful. You know, we can tweak the dose, you know, and keep it at a minimum, but you know, the consequences are not a worse. And you know, he'd quite often come in and just have a little chat and show me how his hands were doing. And then when I left that post, he came in with a little pot plant for me, just a very simple little pot plant, and it was so touching. And it's just, you know, little small things that we can do. So that didn't feel like anything to me.
But it's
You
the impact of kindness, isn't it? And
know.
being heard and being seen and being in that safe, supportive place. And that's because you've been trained, like I was trained in nursing. Compassion oozes out. And then when it's received, and it makes an impact, it's a magnet, isn't it? So Karen,
Yeah, because
sorry,
I was just going to say, a lot of us go into it, you know, into healthcare, medicine, pharmacy, nursing, to help people and care for people.
It's a calling.
Yeah.
You called. Are there any other little points you'd like to make at this stage? I know that I'm going to put quite a lot of leads to the IHPE and to a lot of the topics that you've mentioned. Is there anything in conclusion that you would like to leave us with?
Two things possibly. I'm just having a glance at some notes when we were planning about the importance of not just focusing on individuals, but environmental change. So that's in, you know, health promoting settings, supporting communities, and the environment. You know, so people have those basic needs met, and environments are such to promote health, like that housing development that I mentioned. Oh, there's one other thing, but it's gone. That was obviously the most important part.
Thank you.
Oh no, it's come. It's come. It's getting late. I've had a busy day. Yeah, I think, you know, like Susie, I'm so passionate about meditation and mindfulness and what a difference it can make, and the evidence shows us that. Highly recommend the work of the Mindfulness Initiative in providing that you know, evidence base of what mindfulness in particular can and can't do, as far as we know so far. But I do wonder more and more whether we ought to be thinking more about mental training, mindfulness and meditation as mental training, and as part of health. And you know, I don't think it's often we meet where Richard Davidson, the neuroscientist, doesn't come up, and you know how he talks about well-being as a skill, and part of the skill is in this mental training and gaining more, you know, taking care of our minds. And he sees meditation as important as brushing our teeth, and his vision is that one day, you know, that more of us will see it in that way. But I do wonder whether we need a shift to thinking more of it as mental training, and there's so much more to it than, you know, what does, I think Jack Cornfield talks about there are 108 different practices in the insight meditation tradition, and we need more research to understand which practices help which people, because we're all so individual that there isn't a one size fits all with this, which I think is one of the strengths of this feast, actually, is the variety of teachers and practices that you're offering. so that can people, and we talk about empowerment, so people can choose what's right for them, because we don't know. It's up to the individual to decide what's right for them, so that empowering people to do that.
Thank you. And talking about Richard Davidson is the power of the meditation and the neuroplasticity and the ability to respond in a positive way through the lens of science. Was it the Dalai Lama who said to him, "You've got all these machines to look at studying diseases of the brain. Why don't you look at through the same lenses, but look at what makes people resilient and happy and thrive?" And so he said, "Okay."
He made him a promise, didn't he? Because I think up to then it was a lot about what goes wrong and researching pathology. And so the Dalai Lama invited him to research what goes right and what helps us to flourish.
Yes.
Amazing work. And the neuroscience is just fascinating. What a difference. It can even change gene expression, as one of the studies Davidson was linked to, looking at inflammatory markers. It's just huge, but we need to find out, we need to make it more accessible. I think it's increasing, especially in the UK, with the National Institute of Clinical Excellence recommending mindfulness for depression, and now in the workplace as well. And we're training more teachers, particularly in the MBCT, mindfulness-based cognitive therapy. But there's more. One of my dear teachers, Dr. Patricia Collard, told me that someone had said to her, "Patricia, mindfulness is everywhere." And she said, "Not everywhere enough," which I thought was brilliant, because it changed my life. I've shared a few things on Sunday, and the neuroscience, and with neuroplasticity, we can rewire our own brains. We can, the evidence is strongest for pain, depression, and addiction. And addiction problems are huge. I've been reading about it in America and the UK. Fentanyl use and alcohol. And mindfulness. The evidence is strong for mindfulness supporting people with addiction.
It's exciting times, isn't it?
It is.
And the role of the pharmacist, particularly yourself, a pharmacist and a mindfulness and meditation teacher, a researcher. You're coming from a very solid background, so we're thrilled that you've shared all this with us today. And let's keep on talking.
I hope so. And, I like talking. We'll talk about this all day.
Thank you, Karen.